I think when we look back at our lives, I always think there is that hand of God that's leading. I would never have chosen nursing as a career, and I did it in response to a need. I was at that point a sister of the Holy Family of Nazareth. We had started a baccalaureate program in nursing, and the community was great. They said, if there's not a good fit here, we can transition you into science or something else. But when I started nursing, it was a match made in heaven. And whether it was wiping an older person's dirty bottom or having a real heart-to-heart with somebody who had just heard the words cancer as a diagnosis, it was where I wanted to be. But as I continued to work in nursing, I saw so often the healthcare system, as well as individuals, not working. Both physicians, my own profession, nurses, sometimes being less than we needed to be for families. And so I wanted to think of how we could do it differently. And when I came to Georgetown to study bioethics, I met Dr. Edmund Pellegrino, and he was an incredible influence on my life. He's been such a strong voice for humanizing the profession of medicine, and really created an ethic that was different than the predominant secular American bioethics movement. He grounds the moral obligations of healthcare professionals first in the vulnerability of the patient, then in the promise that we make as professionals not only to be competent, but to use that competence to secure the interests of patients, and then having us work collaboratively toward a real act of healing. And that was a vision that caught me, and it's something that I want to share. I think what I'm about now is trying to create that moral space where we can all step back from the busyness of our lives and our professional practices and look at, I always say the key ethical question is, at the end of the day, are people better or worse for having experienced us? And that's what I want to invite people to think about. So whether you're a health policy person in Washington, D.C., on the Hill, you're a clinical researcher, you're the administrator of a healthcare system or of a unit, or you're somebody who puts hands on people at the bedside, we all have that power to influence other humans. So I just have profound respect for my faith commitment, which is my motivation for wanting to do this, the clinical skills that I have that helps me understand the world, not only of health professionals, but of patients and their families, and then the philosophical tools to invite critical reflection on what we do and why.